Good morning and welcome to another segment of Wellness Wednesday where we have Dr. Sayfo of Uncommon Orthodontics here to talk about dental wellness. I'm Kevin Seidenstricker with American Media, an affiliate of Mansion Entertainment Group. Doc, welcome back to the studio.
Good morning.
Always a pleasure to have you here.
Thank you for having me.
We understand that no matter how good you are at your trade and your profession as a doctor, you can only do so much. And once a person gets out of your chair, responsibilities kind of shift, don't they?
Yes. I always tell the patient that it's a teamwork, like between everybody in the office, myself and the staff and our expertise and everything, and the patient himself or herself, and the parents as well, if the patient is on a younger age. So today we want to talk about the patient responsibilities during the treatment or first day of starting treatment. And we're going to try to divide this between the patient that is treated with braces or fixed appliance and the patient that is treated with aligners or removable appliances.
Okay.
Because there's a little bit of differences between these two.
Yeah, so what happens with the patient within the first 12 hours after you've applied braces or aligners and they walk out of your office?
So the first thing the patient asks about them is is there going to be any kind of a soreness or pain? I tell the patient, yes, there will be soreness. There's something stuck on your teeth. The wire is going to start working. There's some pressure on your teeth. It is really not that bad, but of course, pain is subjective. It depends on the person himself or herself. It's always recommended to take some mild painkiller first day just to help you with that kind of soreness, but it's not really that bad. So the patient that is treated with braces, majority of patients in our office at least, they have responsibilities that I usually look at them on 3 levels. One of them is going to be related to food restrictions, because the bracket is glued to the teeth. We have to be careful not to eat or do anything that can lead to the bracket to be broken or break the bracket. Now, from a food standpoint, the patient needs to avoid eating anything hard, chewy, or crunchy. Anything harder than usual. Let's say nuts, popcorn, beef jerky. Those kind of like examples, but or chewing on hard candy or any kind of thing. Once we start with the patient, we give them a list of the things that they should avoid. But at the same point, it's kind of like the golden rule is, if you look at something and you question, is that might break a bracket? Most probably it will. So try to avoid that kind of food. Now, it's not only about food, but sometimes don't chew on stuff. You'll be surprised. Stories that people come back with broken brackets, and when we ask them, so please don't chew on pencil, cap, bottle, whatever things that should not be in your mouth that you chew on. Please don't chew on those, because there's a high risk that you're going to break a bracket or brackets. The second one that is extremely important is to adjust your hygiene regimen. Some people will brush once a day or twice a day. That might not be enough when you have braces, because braces will help kind of like trap your food around your teeth. So you need to really brush every single time you eat. Now, if you are someone who snacks all the time, I would recommend try to change even your nutrition or eating habits. Limit the time that you snack. Now, it's up to you. If you snack 10 times and you brush 10 times, be my guest, no problem. But I don't think this is realistic, and you're gonna start dropping the ball and eat without brushing. So try to limit the number of times that you eat is really beneficial. Brushing is extremely important. You have to change the technique of brushing. Instead of just keep brushing the same way, you have to look at the tooth as divided into multiple surfaces, like an area above the bracket, an area below the bracket, the area between the brackets. You have to use a little bit of extra kind of accessories, small tiny brush to clean under the wire. And I mentioned this multiple times, the best thing we recommend is adding to your arsenal the water pick. Yep. It helps you with flossing and brushing as well. It is amazing and is really a game changer on that level.
So there's dietary changes possible, dental hygiene changes possible.
Yes.
And that's with brackets and aligners. What about other than that?
Now, you have to keep some habits. Brackets should not change your 6 months visit to your dentist for checkup and cleaning. having braces should not stop you from going to your dentist to get your regular cleaning. They can do amazing job. Actually, I have a cleaning appointment today at the office of Dr. McGinty and Dr. Spriggs. Hey guys.
Yeah.
So I do mine every 6 months, and I think everybody's supposed to do it, even when you have your braces on, with regular checkup. If there's a cavity, they have to fix it as soon as possible. So hygiene should be kind of like a improved. You have to take it very seriously. You do not want to end up with white spot lesions or cavities or even gingivitis at the end of your treatment or during your treatment.
Okay. And Doc, does that pretty much wrap up patient responsibilities post-treatment?
Now, we have to remember that if we add anything that's going to be patient-specific, like if we ask the patient to wear rubber bands, it's a part of the treatment. So it's not kind of like whenever you feel so, you have to follow the regimen. Similar if you go to the doctor and they tell you have to take medication. If you don't take your medication, you're not going to get any better. So any instructions that we give to the patient, they have to strictly adhere to this one. It's a medical recommendation. It's not like, it's not a suggestion. On the other hand, come to your appointment. You'll be surprised. People sometimes laugh at me like, what do you mean come to my appointments? Yeah, I have so many patients that they start the treatment and they come every 5 months, 10 months, sometimes they disappear for a year. That's not going to take your treatment anywhere. Treatment needs to be moved forward by us adjusting the brackets or adjusting the wire and doing something every single time you are there, or at least when needed.
Gotcha. And where can somebody come visit you for a consult or other options?
Let me first talk to you about the aligners.
Oh, yes, thank you.
I don't want the patient with aligners to think that we are just ignoring them, right? Because that comes with responsibilities as well. We mentioned that with braces, the responsibility is kind of like attached to the fact that they are glued to your teeth, and now you have to change a lot of habits, right? With aligners, you don't have that problem. Yes, you don't have that kind of limitations about eating. You can eat whatever you want. You can drink whatever you want. But there are some responsibilities. I'm going to make them as quick as possible. First, with aligners, you have to wear them 24/7. If you cannot adhere to this system, aligners are not for you. Aligners can treat almost every single case as long as you wear them 24/7. So it is extremely important, 24/7. Now, minus the time that you eat. This is one of the responsibilities. You cannot eat with them or drink anything beside water, because they're going to trap that food, trap that liquid, and if it has sugar or acid, it's going to eat into your teeth, and if it has food, it's going to look really, really nasty. So we have to really strict to take your aligners out, keep them in a safe box that we give you with every single case, finish your food, brush your teeth, put them back on.
Right, because you don't want to skip that step of brushing your teeth after you eat and put those liners on.
Extremely important. Extremely important, because when you don't brush your teeth, same thing. You can put this plastic on your teeth that are covered with food or liquid or anything, and that's going to keep working on and fermenting and work on your teeth. So the biggest thing about aligners is wear it 24/7. Take it out when you eat. Don't eat or drink with it beside water, and keep it safe. Now you have to clean it. You have to keep it clean. You have to maintain it. Keep it away from your pets, because believe it or not, they love chewing on those things.
Sure.
They love chewing on those things. So the golden rule here, I tell the patient, a liner is either in the face or in the case. You don't put it on a tray. You don't put it next to your bed, because the dog or the cat or any pet that you have, they smell you into that piece of plastic. It becomes the most favorite toy, and it takes seconds, and they will chew on it, and now you need a new one, and that's going to complicate your treatment. But technically, that's the most important one, because in regard of food or brushing and flossing, it's similar. It's the same with aligners, because there's nothing really blocking that brush from brushing naturally, or blocking you or stopping you from eating anything you want with aligners, beside of course the bad food that we recommend against it,
Of course.
Beside that, I think these are the responsibilities that the patient is supposed to really be aware of before they start the treatment, so they can choose the right path for them, aligners versus braces, and they have to adhere to it along the whole period of the treatment, regardless of how long it is.
Awesome. Well, Doc, thanks for being in American Media Studios today.
Thank you. Thank you.
Dr. Sayfo with Uncommon Orthodontics, and we want to make sure everybody knows, where can they come see you?
Yes, sir. We Uncommon Orthodontics is located on 2330 South Range Line, and you can find us on online on uncommonortho.com or on Facebook and Instagram.
Okay, thanks again, Doc.
Thank you.
Thanks for watching Wellness Wednesday with American Media, an affiliate of Mansion Entertainment Group.